Hello, and thank you for joining our presentation. Our group consists of 4 members: Jessica Stanley, Vanessa Janik, Angela Pinto, and Cynthia D'Souza. Today, we will be discussing non-experimental research, specifically a cohort prospective design. A cohort prospective design is an observational study design in which participants do not have the outcome of interest at the start of investigation. According to Pollitt and Beck, the strongest design for prognosis-type research questions and etiology questions when randomization is impossible is a cohort design. These observational studies with a cohort design with a prospective aspect start with a presumed cause and look forward to a presumed effect. Defined by Pollitt and Beck, a cohort design is a non-experimental design in which a defined group of people, also known as a cohort, are followed over time to study outcomes for subjects of the cohort. We often ask ourselves whether a study is qualitative, quantitative, or both. In the case of non-experimental cohort prospective studies, they are most often quantitative as they use pre-existing quantitative data. These studies are often conducted as exploratory or explanatory research. The cohort prospective design steps include the researcher recruiting a healthy sample, also known as a cohort. The researcher then collects data on risk factors and outcomes. The researcher then decides if risk factors lead to development of disease over a period that was pre-designated. Lastly, the relationship between exposure and outcome is examined. Why would we choose a prospective cohort study? Well, there are many instances where a prospective cohort study would be more beneficial than a retrospective cohort study. For example, you have access to a larger pool of research subjects and are comfortable using a long timeline. For example, some of these studies go over weeks, months, and even years. It is also beneficial if you are interested in the long-term effects of preventative or therapeutic treatments against exposure to certain risk factors. Your research needs a stronger argument for potential causality. It can be provided by a retrospective cohort study or case control study. This slide also exemplifies a detailed explanation of the steps to a prospective study. According to Capilli and Anastasi, a researcher conceives an idea for prospective cohort design. They then recruit a cohort of people and follow them over a predetermined time based off their mutual characteristics. Characteristics are measured at determined time points in the study. Sometimes these studies are also known as longitudinal studies because they do go over a period of time. The researcher then divides cohorts based on exposure and non-exposure status. The researcher will then evaluate relationships between the exposure and non-exposure groups, and they will determine whether the outcome is associated with a certain exposure. This example is of a prospective cohort study that was done as the recurrence of hypertensive disorders of pregnancy, results from a nationwide prospective cohort study. Lyler et al. Conducted a prospective cohort study to determine the risk of developing a hypertensive disorder during a second pregnancy among those who had developed one during their first pregnancy. Hypertensive disorders of pregnancy include gestational hypertension and preeclampsia. As in the chart shown previously, the authors began with a defined sample of 2,829,744 pregnancies between 2010 and 2018. 8.4% of the sample was exposed, meaning they developed a hypertensive disorder during their first pregnancy. 91.6% of the sample was not exposed, meaning they did not develop a hypertensive disorder. This prospective cohort design thus allowed the researchers to compare the subset of people who did and did not develop a hypertensive disorder in their second pregnancy, based on whether they were diagnosed with gestational hypertension or preeclampsia in their first pregnancy. According to Lyler et al., 2023, pregnant women who had gestational hypertension during their first pregnancy were 4.5 and 5 times more likely to have gestational hypertension and preeclampsia, respectively, during their second pregnancy. Women who had preeclampsia during their first pregnancy were 2.5 and 14 times more likely to have gestational hypertension and preeclampsia, respectively, during their second pregnancy. In terms of preeclampsia recurrence, there was a stronger association among women who developed preeclampsia that was severe or developed before 34 weeks gestation. More than half of those with early or severe preeclampsia during their first pregnancy had recurrence during their second pregnancy. Recurrence of preeclampsia was also associated with maternal age, social deprivation, obesity, diabetes, and chronic hypertension. The researchers conclude that healthcare providers should tailor their counseling appropriately for women who have had a hypertensive disorder in a previous pregnancy. Providers should include discussion of modifiable risk factors and should engage in heightened surveillance during these patients' second pregnancy. Although cohort studies have great benefits, like all research studies, they also have their limitations. One major advantage of a prospective cohort study is that it allows for very accurate gathering of data on things such as factors that may influence outcomes, things that could affect the results and the outcomes themselves. However, this strength comes with a downside. These types of studies often are expensive and take a long time because they require follow-up periods that can be quite lengthy. So while the data collected is reliable, it does come at a cost of efficiency. Additionally, one drawback of cohort studies is that it is not possible to definitively establish cause and effect relationships. The reason for this is that the exposure being studied is not randomly assigned, so there is always a chance that the observed association is actually due to other factors that differ between the group with the exposure and the group without it. These other factors, known as confounders, can have an impact on both the exposure and the outcome being studied. And finally, prospective cohort studies can be susceptible to selection bias because the participants are usually chosen based on a certain criteria or characteristics. This means that the people who chose to participate may not be representative of an entire population. The selection bias can lead to results that may not accurately reflect what would happen in a broader population. Thank you for listening to our presentation, and we greatly appreciate your time.